Yoga and Cancer. This is printed in Yoga and Cancer, Complementary and Alternative Therapy in Cancer Research UK. There are several types of yoga, and they all aim to help you relax using breathing exercises, different body postures, and relaxation techniques. Yoga works with the breath, pranayama, and it improves strength and flexibility through a series of postures or asanas. Yoga uses meditation to aid deep relaxation. What is yoga? Yoga is an ancient form of exercise for body and mind. It aims to improve strength, flexibility, and breathing through a series of postures and movements. It is a whole body philosophy that started over 5,000 years ago in India. Yoga aims to create harmony between your mind, body, and spirit to help you feel calmer. There are about 80 main postures that you can do standing, kneeling, sitting, or lying down, and there are several different styles of yoga, including Hatha, Iyengar, and Ashtanga yoga. Some forms of yoga are quite strenuous, while others are gentler and focus more on meditation and breath work. Yoga teachers claim that the postures will stimulate the nervous system, make your muscles and joints more flexible, and relax your mind and body. Why people with cancer use yoga? As with many types of complementary therapy, one of the main reasons that people with cancer use yoga is because it makes them feel good. Yoga teachers promote it as a natural way to help you relax and cope with stress, anxiety, and depression. Generally, it can help to lift your mood and enhance well-being. Some people with cancer say it helps calm their mind so they can cope better with their illness. Others say it helps to reduce symptoms and side effects such as pain, tiredness, sleep problems, and depression. Yoga can sometimes help you to move around more quickly and easily after surgery for cancer. What it involves. A yoga session usually lasts between 60 and 90 minutes. You can attend group classes or see a private teacher. What it involves will depend on the style of yoga you choose, but you will usually do a series of postures and breath work, which will end with some relaxation time. Wear clothing that you find easy to move and stretch in. You usually need a non-slip mat, and your teacher might provide these, or you can bring your own. You should only practice yoga on your own at home after you've learned the safe and proper way to do the postures. You could injure yourself if you don't do them correctly. Side effects and precautions. Yoga is generally very safe if you do it properly under instruction from a qualified teacher. Qualified teachers usually recommend the following safety measures. Allow at least 2 hours after eating before doing yoga. Don't do yoga alone at home until you've practiced with a qualified teacher. And tell your teacher about any medical problems you have, including back and joint problems, before you begin. Stop and tell your teacher if any posture is painful for you. Never try difficult postures such as head and shoulder stands without being shown how to do this by a qualified teacher. Women who are pregnant and don't have their period shouldn't practice certain postures. Your teacher will tell you which ones. Drink plenty of water after every class. Research into yoga in cancer care. There is no scientific evidence to prove that yoga can cure or prevent any type of cancer, but some studies suggest that it might help people with cancer cope with symptoms and side effects. In 2017, a Cochrane study looked at whether yoga could improve quality of life in people with breast cancer. They included 24 studies. Most of the studies were small, and I'm busy, and so the results need to be used with caution. And thank you. Okay. And they found that yoga can sometimes help sleep, tiredness, anxiety, and depression. You have nothing for me. In March 2010, a review of studies into yoga for patients with cancer was published, and it included 10 trials. It found that yoga could help to reduce anxiety, depression, tiredness, fatigue, and stress for some patients, and improve quality of sleep, mood, and spiritual well-being for some people. The authors of the study said that yoga may have a positive effects on mental well-being, but the review results have been used with caution because there were some weaknesses and differences in the research studies included. A small study of men with prostate cancer also noted an improvement in their quality of life and general well-being when they practice yoga regularly. What yoga costs? A few cancer centers and hospitals in the UK offer yoga classes free of charge. So ask this is available where you're having treatment. And if not, they may be able to direct you to a voluntary organization that does so or for a low cost. It's very important to have your classes with a qualified teacher. You can contact the British Council for Yoga Therapy for a list of organizations that can give you more information about costs. Finding a yoga teacher. There's no single organization that regulates the yoga teachers in the UK, and they don't have to join any organization by law or have any specific training either. But many are registered with one of the organizations listed. You might want to ask these questions. How many years of training have you had? How long have you been practicing? And do you have training or experience of teaching people with cancer? Do you have insurance? A word of caution. Before you begin any yoga practice, make sure that you tell your yoga teacher about your condition. You can adapt the exercises to suit your needs. It's important to take things gently at first to minimize the risk of injury.